Hey, everybody. Welcome to Rituals to Rise. And as I mentioned yesterday, we have a special guest, and it is none other than one of my very favorite sisters in law, Nancy. I call her Mac Warren. Her real name is Nancy Warren now. So anyway, anyways, she is in New York. And Nancy, will you tell them what your job is?
Hi, good morning. I'm Nancy. So I am an AVP for clinical informatics for Northwell Health System in New York, which really means I go between what the clinical nurses need and what they need in technology and computer systems.
So I just want to point out that you started off as a nurse and you went in a different direction. Tell them all of the steps you took to become who you are. Not all,
So
because we only have about 10 minutes, but
it'll be quick. I'll do it a few seconds. I started out as a pediatric ICU nurse ages ago, in the 90s. And that was when they were first going on computerized EMRs and across health systems. And I just took to computers back when we didn't even all have computers at home and got into what is called nursing informatics after about 18 years as a bedside nurse. And then got my master's in informatics and then switched health systems and have started out as a clinical specialist and then became a director and then an AVP and now have a team of about 50 under us that work with across the health.
You're pretty big stuff, girl.
Oh, yes.
So Nancy, you are with Northwell.
Yes.
Northwell Health Systems, is that what it's called?
Yep. Northwell Health. Yep.
Okay, so haven't I heard of in the news with the whole COVID? Haven't I heard over the course many things about Northwell and that? Can you share some of those?
Absolutely. One of our nurses that it was all over the news was actually the first person in the United States to actually get the vaccine, and that was.
Wow.
And our CEO of the health system, Michael Darling, works very closely with Governor Cuomo in New York. He used to work under Governor Cuomo in government, and now he runs our health system. And we are partnering very closely with Governor Cuomo on the vaccine program across New York State.
All right, beautiful. So yes, I've seen many, many times they're using a Northwell physician or a Northwell person for the information and all that kind of thing. And I'm like, wait a minute, we're going to see Nancy one of these days. And so anyway, so last week you told me a story about vaccine distribution. And it just really struck with me because I think about, all the time I think about the power of community and how when we build community, things happen. And, it's one of those things I know in my bones, but it's hard sometimes to find like an example of it. And can you just share with our friends, because you come on rituals from time to time, and you and your nursey friends do it, so that I always tell people there's this little contingent of nurses from New York that come on Rituals to Rise. They're like, really? How come? So, anyways, tell them about that story about how you distributed the vaccines.
Absolutely. So we started out, there's about 80,000 employees in Northwell Health. So they started out with our employees, first of all, and our front facing, healthcare workers, our heroes. And then through a partnership with the governor, we're starting what's called faith-based distribution centers for the vaccine.
So and faith-based, I'm going to just type that into the comments so people can understand it. So yep. FAITH.
Yep. Faith-based. And this is partnering in areas of so we all know that COVID is really impacting people of color and people that have low socioeconomic status a lot. So what it is going into those areas in New York City, New York State, but for us and on Long Island, and partnering with the ministers, the priests, the rabbis of churches in these communities and setting up what are pop-up vaccine centers. So we come in with the technology, the equipment, the clinical staff from Northwell, and we set them up in a day and partner with the clergy so that they reach out to all of the members of their community and get them scheduled in and get vaccines to these people that otherwise wouldn't be able to get them.
Wow, that's awesome. And can you describe to me like walking into one of these churches, how that felt and what you saw?
Absolutely. I one of the first ones I went to was a Presbyterian church in Roosevelt in New York. And The number of staff from Northwell that were there to set up these clinics was amazing. There were members of Cuomo's staff there to help get them going. And literally, when they opened the doors at 10 a.m., people were scheduled. They were socially distanced and safely lined up to come in. And then they would come in, they would be registered, they'd get their vaccine, and we'd also schedule them for their second one when we would pop up in a week. And just, I was so rewarding for me to be there because, clinically I'm a nurse, but I'm working on the backside supporting people in COVID. And, we all feel a little guilty about that we're not on the front lines like Mariah, your daughter, or Meg, my other niece, that are really out there, caring for these patients. But it's just important what we're doing and getting to these community people. And when the church members would leave, they would ask me to come to their church the next day or on Sunday, but they would also just be, thank you so much, God bless you, because they just knew it's so hard for everybody to get this vaccine that we need to fight COVID. And it was extremely rewarding. It was amazing.
Yeah, that sounds like so cool. And the idea of the religious leader, so whether it was a rabbi or the priest or minister or whatever, reaching out, getting them organized, telling them the idea of comforting them, it's okay, we will help you, we will get this done, don't worry if you don't have an address, whatever. And just the thought of I can just visualize these people coming in and how grateful they must have been. I know how stressful this vaccine is for our elders and for the people who are at risk. And I just think that this is such a cool example of community.
Yep, it really is. It's awesome to be part of it, and we're continuing. So we're popping them up each week. We continue across all of New York. So
that is awesome. Now, will you be doing it? Will you be actually physically going out some more, or will they stick you back into the office again?
Yeah, no, I won't. It will now be my staff doing it. They pull me in at the beginning to set it up, get the process worked out, create the original guides, and support the first. But it's awesome because now it gives my team, who are also nurses that aren't necessarily on the front line, they're getting the opportunity to go out there and help at each one of these centers too. So
yeah, I just know when you volunteer in a setting like that, you actually get to see who our neighbors are. And it makes it really real, and I think sometimes, with this whole vaccine and whether or not people are choosing to get it is realizing for many, this is a life or death situation, and I just think it's extraordinary what you guys did. And I just think that, I just wanted to thank you and just again, it just spoke to me because it was such a cool thing to do. And, you were able to be part of it. And, as you say, when you're in the back end or you're on the computer, a lot of times you may not personally feel the impact that, as I say, I call them our sheroes, right? All our she heroes out there.
Yep.
And so it's just so awesome that you get for a minute to experience, what kind of impact you're having on somebody's life and also on the community and also on, on just, as I say, paying it forward, building it up, and together I think we get better. And that's the whole idea.
Absolutely. Absolutely.
All right. Awesome. So what are you going to do today?
Work from home.
Are you working from home?
Yes, I'm working from home today. Yep.
Yeah. So, anyways, maybe we'll have you on again about real estate and about how they're consolidating centers and how you guys are never going back to the way it was. Because you know what? I talk a lot about that in class. I know this is a pivot away and it's, losing its touchy-feely, awesomeness, but it's such a good example of what we're going to need for creative space and seeing how cities like yours and innovative cities like yours are going to be handling, taking those buildings and cross-purposing them and maybe creating some housing for people.
Absolutely. Yeah. The new remote workforce of the future. Yep.
Yeah. All righty, girlfriend. Well, thank you so much for being on. And I appreciate it. And thank you for what you do because, as I say, it's not as sexy as getting, all those nice things that maybe some of the other people are getting. But I think that, that day that you matter to a lot of people.
Thank you, Katie. My pleasure.
All right, girl. I'll talk to you later.
Okay.
Bye, friends.